Recently in the Dáil, my colleague, Deputy Pearse Doherty, expressed... can I still have the time? Yeah. No, that's okay. I'll wait till you've changed over.
No, by all means, have the time. Aisling asked me to take over after, it was an impossibility for me to be here before you started because I just finished myself.
That's no problem.
So by all means, go ahead for it.
Thank you, Acting Cathaoirleach. So, Acting Cathaoirleach and Minister of State, recently in the Dáil, my colleague, Deputy Pearse Doherty, raised the issue of chemotherapy patients from Donegal being forced to travel to Galway yet again because of the failure to recruit a consultant in Letterkenny Hospital. And the Minister for Health, Simon Harris, wasn't present that day. And Deputy Pearse Doherty expressed his outrage. And the response he got in Donegal was massive to the Minister for Health not being present to deal with the issue. And with all due respect to a very decent Minister for State, Corcoran Kennedy, who I know, I am disgusted that the Minister for Health, Simon Harris, isn't here today to deal with this issue, particularly when he knows the anger in Donegal at the last time that he didn't show up. So here we have the second time where there's a big issue in Donegal in relation to cancer services, and he isn't here to deal with it in person. So I hope that we will have a very detailed response today. The background to this is that 2 years ago, it was brought to the government's attention the crisis in the area of breast cancer diagnostics and surgical operations in Letterkenny. And following that, there was a meeting of the cancer campaign groups, the Oireachtas members, HSE, CELTA, and all the senior Department of Health officials to try and resolve these issues. And it was agreed that we would have a second breast cancer consultant surgeon allocated to the hospital because the work and demand that the current surgeon consultants are under is untenable, absolutely untenable. A year later, in January 2016, Minister Joe McHugh confirmed that the Minister for Health then, Leo Varadkar, was shortly going to advertise this position and that this issue would be resolved a year after the crisis manifested itself. So here we are now, 2 years on, and I am led to understand that the National Cancer Control Programme are apparently blocking the appointment, that this issue has not been resolved, even though we said to them that if you don't have the numbers of cancer patients in Donegal, and by the way, the cancer surgeon that's there now is dealing with, the breast cancer surgeon is dealing with 3,000 cases per annum. 3,000. A backlog is growing all the time. And people are fiddling while Rome is burning in relation to this situation. So what I want today is a timeline and confirmation as when we will have our second breast surgeon consultant in Letterkenny to take the pressure off the one that's there, to make the service sustainable, to give a guarantee to people in Donegal, and indeed recently we had the Northwest Cancer Centre open, where we have Derry, Tyrone and Donegal working together. Now, if there's a shortage of numbers in terms of a second breast cancer surgeon in Donegal, we should be looking at Derry, Tyrone and Donegal again for the critical mass that's required. This needs sorted out. It's 2 years, it's ticking on, and I need confirmation today on behalf of the Donegal, people of Donegal, that this is sorted once and for all.
Thank you, Senator. Minister, to respond.
Thank you. I'd like to thank Senator Mac Lochlainn for raising this very important issue here today and giving me the opportunity to update the House on the matter. In 2007, in recognition of the particular and unique geographical circumstances applying to Donegal, the Department set very clear policy direction approved by Government that Letterkenny Breast Cancer Service should operate as a satellite centre of University Hospital Galway. Specifically, on a sole exception basis, Government agreed that Galway should be permitted to enter into outreach services delivery in Letterkenny as an additional activity. This exception was subject to a number of conditions, including case volumes, meeting the minimum criteria, and all other quality assurance standards being satisfied on the same basis as for care being delivered in Galway. The CELTA Hospital Group has always expressed a strong commitment to continuing the Letterkenny service as a fully integrated part of the symptomatic breast disease service in Galway, including through a joint multidisciplinary team approach. The Letterkenny service has been run by a single consultant who also undertakes general surgery at the hospital. Support is provided by Galway-based Celta consultants who travel to carry out clinics in the Letterkenny service to meet needs arising. Recently, with surgical vacancies arising in the hospital and with patient referrals increased slightly, the Letterkenny service has been under some pressure to meet key performance indicators. While a particular focus has been maintained on urgent referrals, challenges are arising in relation to addressing non-urgent breast cancer referrals in a timely way. Steps taken to address this situation included using locum consultants to undertake clinics, increased clinics undertaken by Galway-based consultants, and the referral of some women with their agreement to University Hospital Galway. In mid-2016, a locum surgeon was in post in Letterkenny for a period, and this had a significant impact on waiting lists. With his departure, further measures are required to address the issue. In the short term, steps are being taken to appoint a full-time locum breast surgeon as soon as possible, and Galway-based Celta consultants will increase their level of support to the Letterkenny service. Meanwhile, the requirements of the Letterkenny breast cancer service in the medium term are being assessed. This is being done in the light of the clear evidence that patients who are operated on by surgeons who carry out higher volumes of surgery achieve better outcomes. Efforts have already been made to recruit GP support for the Letterkenny service, and these will be renewed. The appointment of an advanced nurse practitioner is also being pursued. The possibility of further cooperation with health services in Northern Ireland will also be explored in the future, building on the level of cooperation achieved in relation to the North West Cancer Centre at Donegal Hospital. This centre opened in November last year, and it is providing access to radiotherapy services to people from both jurisdictions in the North West. I would emphasise that Minister Harris is very committed to providing high-quality, safe healthcare to patients in Letterkenny University Hospital. A significant number of capital projects have been carried out or are planned, including a medical academy, a blood science laboratory, expansion of the recovery unit, and renovations to provide accommodation for pharmacy, a respiratory lab, and a cardiac investigations facility. And in conclusion, I wish to assure Senator Mac Lochlainn that Minister Harris is committed to the continued provision of high-quality, timely services for patients attending breast cancer services in Letterkenny University Hospital.
Thank you, Minister. Senator.
I would say this, I have to say that Minister Harris should be here today, considering his failure to be in the Dáil for the recent related topical issue raised by my colleague Deputy Pearse Doherty. I just want to clarify, it says here steps are being taken to appoint a full-time locum consultant breast surgeon. Now, locum in my dictionary is a replacement. It isn't a full-time second position working in tandem with the single-handed consultant that's there right now, who's under ferocious pressure. Everybody knows this for 2 years. Now, here's the concern of people in Donegal. We welcome the North West Cancer Centre that's opened in Derry. We welcome looking at Derry, Tyrone and Donegal, the critical mass of population, to ensure that people don't have to travel from Donegal to Galway or Donegal to Dublin, as they have for years. It's inhumane, it's indecent, it's wrong what we have forced on people in Donegal. So what we want to know is that, will there be a second full-time consultant breast surgeon, not a locum, a full-time, because that's what was promised to us in the mouth of an election in January last year. Statement here, Minister Joe McHugh, Minister Leo Varadkar. That's what was promised to our people. It was welcomed by the cancer campaign groups. And we have sat and waited for this. And in the last week, myself and Deputy Pearse Doherty have been advised by the cancer campaign groups and by senior people within the hospital that this has been blocked. This position has been blocked. So what I want confirmed is this a second consultant surgeon, not a locum, but a second consultant surgeon working on the numbers of patients? I said 3,000 patients who are being dealt with by the current team there every year. Hundreds and hundreds on a growing waiting list. So what we need assurance is, will there be two consultant breast surgeons at Letterkenny Hospital, not locums, not drop in and out arrangements, two, so it can be a standalone service working in partnership now in terms of the chemotherapy that we need to strengthen at Letterkenny and in terms of the radiotherapy services in Letterkenny. What we want essentially in Donegal and the North West, We want to ensure that cancer patients from diagnostics right through to radiotherapy can be treated within their region, that do not no longer have to travel. We want equality of cancer care, equality of access for our cancer patients in Donegal. So I need an assurance today that is happening. That is on the way, not locums, not replacements, not part-time drop-ins, that we have a quality of access for our patients in Donegal. That's the commitment I need. I wish the Minister for Health, who is responsible directly for this, was here, but I would ask you, Minister, to try and give me that assurance, or get him to contact my office as soon as possible to give that assurance.
Thank you, Senator. Minister, did you want to respond?
As you know, the Letterkenny service has been run by a single consultant, and in 2016 a locum surgeon post was in position there to address the waiting lists. Now, I have been advised that the steps being taken in the short term are to appoint a full-time locum consultant breast surgeon as soon as possible, and that the Galway-based CELTA consultants will increase their level of support to the Letterkenny service. But I do appreciate the clarity that you require, and I'll endeavour to get that for you. And can I also convey Minister Harris's apologies for not being here himself? He was unavoidably engaged elsewhere.
Thank you, Minister.